Before we jump into various indication of radiation for treating various different type of melanoma, maybe we can step back. You can give us a background about how does radiation work? You used various modality like X-ray therapy, brachytherapy, proton therapy, and what are those modalities and how do they all like sort of work in a very general sense?
Sure. So when it comes to cancer radiation therapy, generally what that refers to is the use of high energy ionizing radiation. And this is typically directed to a tumor or an area where we think cancer cells may be. And fundamentally, we think the biologic effect of this is that the high energy ionizing radiation can damage cells and ultimately lead to their death. Now, obviously, the cells that we're trying to damage and kill with radiation therapy are cancer cells. And we think that generally speaking, cancer cells are more susceptible to the deleterious effects of radiation than normal healthy cells are. However, during a course of radiation therapy, it's not unexpected for there to be some damage or injury to those nearby healthy cells. And that, generally speaking, is what leads to side effects. So side effects of radiation therapy can vary, depending what part of the body the radiation is being given to, how much radiation is given, the way in which it's applied. But this is essentially kind of the binding theme for cancer radiation therapy. And as you mentioned, there's different ways that we can deliver high energy ionizing radiation therapy for cancer. Broadly speaking, brachytherapy and teletherapy or external beam radiation therapy are kind of the two categories of radiation therapy that I, as a radiation oncologist, use and would be used in the treatment of melanoma potentially. Brachytherapy just refers to putting a radioactive source or device very close to where the tumor is. And letting the radiation, emit over a very short distance to where the cancer cells are. Again, teletherapy or external beam radiation therapy involves the use of a machine that produces a beam of radiation, and that beam is sent to the area where the cancer cells are. You can sort of think about that like the beam of light that comes out of a flashlight. This is often how I describe it to patients. You turn a flashlight on, a beam of light comes out, you can shine it where you want it to go. And in a similar way, we use a big machine that produces a beam of high energy ionizing radiation and send that beam where we think there could be some cancer cells. These are kind of the more common forms of radiation therapy for melanoma. There are other ways to deliver radiation. For example, in some rare situations, you want to give radiation to the entire body. You could do that with a beam of radiation. That has been done in the treatment of melanoma prior to autologous cellular therapy. It's not commonly done at this point, but it has in the past. There's also methods of delivering radiation to the entire body or body compartments using unsealed radioisotopes. Again, not something that's been done very often for melanoma, but for other cancers, for example, prostate cancer. This is a standard treatment. So, yeah, I mean, in short, there's a lot of ways that radiation therapy can be used for cancer, including melanoma.
Got it. I mean, I think that's a very good global overview on how